At Ovarian Cancer Canada, as mentioned just now by Barb and Alicia, we put the patient at the forefront of everything we do. Patients are embedded in all aspects of our research, such as serving on grant review panels, consulting on funding proposals and patient resources, and becoming active members of research teams. Tonight, we are introducing you to a handful of these incredible women who are involved with the Patient Partners in Research program and will share with us their motivations for getting involved, also some of their experiences that they've had to date as a patient partner. So I'd like to introduce you now to Dr. Jessica Lawson, who is Ovarian Cancer Canada's research coordinator, who will introduce you to our panel of patient partners in research this evening. Over to you, Jessica.
Great, thank you so much, Steph, and thank you for the introduction. So as Steph mentioned, I'm the research coordinator here at Ovarian Cancer Canada. I have 14 years of educational training in cell biology and genetics, and I've been in the cancer research field since 2013. In 2016, I switched my focus to ovarian cancer when I started my PhD, and my research project aimed to understand the genetics of a rare type of ovarian cancer called adult type granulosa cell tumors, and to develop new research models to study the biology of these cancers. After my PhD training, I took a quick break when I had my daughter, and my family and I actually moved across the country. We now live in Montreal. Last summer we did, and then I started working with Ovarian Cancer Canada in August of 2022. So in my role, I co-lead the Patient Partners and Research team with our scientific advisor, Dr. Alicia Tone, and our two patient partners, Donna Pepin and Shannon Kadar. So you'll hear from Donna and Alicia, who are moderating the training session later tonight, so stay tuned for that as well. And as Alicia mentioned, the Patient Partners in Research program was developed by Ovarian Cancer Canada to keep the voices of those with lived experience at the forefront of research. And engaging ovarian cancer patients as partners in research really reflects our philosophy that scientific as well as clinical inquiry can be modified and enhanced by valuing the input and viewpoints of those affected by this disease. And this type of patient-centered research prioritizes research questions that patients and their loved ones deem relevant and meaningful. So today we'll be talking to 3 members of our Patient Partners and Research team, but we want you to know that our team has really grown to include 18 members from all across Canada. We have individuals from British Columbia, Saskatchewan, Manitoba, Quebec, and Nova Scotia. So I'll first give each panelist the opportunity to introduce themselves, including a bit about their story and what motivated them to get involved with our Patient Partners and Research program. So first up, we have Julee Pauling, who's joining us from Ottawa, Ontario. Julee.
Hi, good evening. Thanks, Jessica. Hi, everyone. My name is Julee Pauling, and I've been a patient partner since the program first began. I became involved with Ovarian Cancer Canada when I was diagnosed with stage 4 high-grade serous ovarian cancer in 2011. And at the time, a colleague of mine created a Walk of Hope team in my name. Like many, although my first several months of living with ovarian cancer were spent in a haze of shock and medical activity, I knew going in that ovarian cancer was not a form of cancer that women lived with for long. And thus, Ovarian Cancer Canada's advocacy role became a very important source of engagement for me, as well as for both hope and power. The first Walk of Hope I was in was championed by Canadian figure skater Elizabeth Manley. And it was important. I was met there by members of my family who had come from all across the family to support me in the walk, but also by members of my medical team and strangers who had read my blog and simply wanted to come and be there. And then in 2011, Ovarian Cancer Canada just happened to be ramping up its efforts to prioritize research into finding new outcomes and clinical options for this most fatal of gynecological cancers. And good timing, I was very pleased to be included. I appeared on local TV news outlets a couple of times. I was present at the lobby day on Parliament Hill in 2017, at which OCC was successful in its appeal to the federal government to allocate the $10 million specifically to ovarian cancer research in the next federal budget. And ultimately, I became involved in many other amazing opportunities, of which you will hear more about in this session. So thank you so much for inviting me here this evening. I am thrilled to be part of this tremendous celebration of our work here tonight.
Thank you, Julie. I'm so happy to hear that you had such an amazing support system and that it really motivated you to connect with Ovarian Cancer Canada and be involved in all our advocacy efforts. Next up, we have Martha Hoyt, who's joining us from Toronto, Ontario.
Good evening. Thank you, Jessica. I was initially diagnosed in 1991 with a rare type of ovarian cancer, granulosa cell tumor. Very little information was available. Truthfully, there was little information about ovarian cancer in general. My surgery, discovered during infertility testing, was conservative, a right oophorectomy respecting my wish to have more children. Our son is now 31 years old. Raising a family, working full-time, tending to a busy household, life returned to normal. Our world changed when this indolent cancer returned in 1996, almost 5 years to the date of my original diagnosis. I had a full hysterectomy, 5 weeks of daily radiation, and a year-long recuperation. My oncologist was realistic, and I knew that I was dealing with a far more invasive disease. Well aware of the statistics, I grieved for what I might miss. This is when I became involved in what was then a nascent family foundation established by a politician in honor of his late wife. The greater my involvement, the more I realized how very few advancements had been made in the past 50 years. Cut, radiate, and poison, the standard practice of care. Silence was not an option, and the situation was dire. Women were being misdiagnosed and or diagnosed at late stages. Family doctors, often the first line to diagnose, were struggling to get speedy access to imaging, and there were a number of gynecologists who were considering leaving the province to practice elsewhere. As my energy returned, so did my anger at the lack of progress. I channeled my passion into changing the dial on this disease. From this small but mighty group evolved into what is now Ovarian Cancer Canada. I'm proud of the roles I've played as an advocate, a peer supporter, a speaker, fundraiser, and vice chair. Several surgeries, 4 recurrences, and 32 years later, I'm humbled to see how my colleagues are changing the landscape of ovarian cancer. They are my inspiration, each of whom gives 100%, many undergoing treatment. And I think I speak for all of us when I say that we're only a smattering of the 3,000 plus women from sea to sea to sea who are so grateful for what is happening now. You will hear more about this progress today.
Thank you for sharing your journey, Martha. It's so incredible to hear that you were involved since the very beginning and to be able to see how far we've come as an organization, and it just must be amazing. So it's really cool. So next up, we have Livia Julee, who's joining us from Windsor, Ontario. Livia?
Oh, hi, Jessica. Good evening, everyone. So as Jessica mentioned, my name is Livia Julee, and I've been a registered nurse for over 20 years. I have experience in the hospital, the insurance side, and also the administrative side. My personal integrity has always been centered on caring and advocating for the health and well-being of others. But after being diagnosed with stage 3A high-grade serous carcinoma in November 2020, my life completely just flipped right upside down. I was just thrusted into being on the opposite side of healthcare, and I really felt so alone. And it took browsing online and actually coming across Ovarian Cancer Canada to find hope. And I watched a symposium that was very similar to the one that we're at this evening. And I heard from other patient partners in research members, and they were sharing their personal journeys. And all of a sudden, it was like this amazing relief. I am not alone. I felt so moved to get involved. So now as a second-year patient partner myself, my desire really unites with all of my teal sisters that are out there. We're the voices that empower research, and we are demanding change. So I'm currently 2 years out from chemo with no evidence of disease per my last CT, but I continue to live with severe sensory neuropathy, and it has, it's really impaired my life. My tumor came out of nowhere. I only had 2 evenings of pain when I was just rolling over in bed at night. So I went to go see my family doctor, who said, oh, why don't you go to the emergency room, get an urgent CAT scan? And there you go. That showed a 15-centimeter tumor coming off of my right ovary. So surgery was done immediately that evening. And I was really lucky I had pain because my tumor was actually just rupturing into pieces. If that pain would not have been there, I would not have survived into the following week, and I would not be with you here tonight. So thank you, everyone.
Thank you for sharing your story, Livia. We're so happy that you're here with us today, and we're so lucky to have someone with such unique experience with the medical system as one of our patient partners in research. So we'll start with our questions. My first question is directed to Julie. As you mentioned, you were involved in Ovarian Cancer Canada's advocacy campaign that secured the $10 million investment from Health Canada in 2019. You also recently consulted as a patient partner on our strategic science fund application that was submitted to the federal government in September 2022. What excites you the most about what Ovarian Cancer Canada's present and future research about Ovarian Cancer Canada's present and future research directions?
I feel very strongly about this. What excites me most is that it feels like I am helping to right a long-endured asymmetry in the efforts to identify, treat, and manage ovarian cancer against other forms of cancer. And at a high level, it seems to me that sufferers of ovarian cancer were mostly left in silence, and often briefly, as they lived typically only in measures of months after initial diagnosis rather than years. And in my experience, doctors had been willing to talk about breast and other cancers when it came to hereditary forms, but they kind of left that 50-50 chance of developing ovarian cancer mostly off the table. It was just too dire. So, flash forward, we're seeing that it's not just elderly women who are affected by this disease very late in life. It's young women in the prime of life who are also being struck down by various forms of ovarian cancer, often going undetected until it is too late. So in 2017, when I was part of this lobby day on Parliament Hill, the time was well past due to address inequity in scientific research funding, to access to treatment and clinical trials across the country. And I am proof positive, as are many of the women in our network that you're meeting here tonight, that you can live a long and meaningful life after a diagnosis of ovarian cancer. Survival cannot just be an accident of living close to well-supplied urban centers and having the luck of knowing someone at the right time, as I did, to kind of get in and get things imaged in the right way. Survival of ovarian cancer has to be just as much a research concern as any other form, and not denied due to logistical difficulties or a lack of knowledge. So for me, this is an act of social justice, as well as being a partnership with researchers in changing the outcomes in survivorship. And we have the means to do better. And I think Canada can and absolutely should be at the forefront of making it so.
Thank you, Julie, and thank you for bringing up some of those points. We're very lucky to have you as a patient partner and advocate. So thank you for all the work you've done with us. Martha, one of Ovarian Cancer Canada's top priorities is to fund research into all types of ovarian cancer, including the less common types. As only a few women with these rare types will be seen at a single Canadian cancer center every year, national resources, including tissue banks of patient specimens, are needed to propel scientific discoveries forward. So Ovarian Cancer Canada funds 7 biobanks in 6 provinces, and more than $2 million of OVCAN funds have been directed to projects relating to rare types of ovarian cancer. As someone living with a rare type of ovarian cancer, can you tell us what it means to you to know that research into your disease is a priority?
Yes, in one word, elated. Rare types of ovarian cancers are often described as orphan cancers. And it's not only the lack of funding and research, it's the sparse number of women who are able and well enough to advocate for the limited research dollars. When I was diagnosed in '91, I wasn't offered genetic testing. No labs were conducting bench research, and my treatment options were the same as those offered to women diagnosed with epithelial ovarian cancer. That's all changing. We now know that endocrine therapy is shown to help stabilize or even decrease tumor size in certain rare forms of cancer. Targeted radiation may slow tumor growth, and there are more chemo options and combinations, but much more needs to be done. We need additional clinical trials in all types of ovarian cancer. And we need to continue work in high-grade serous ovarian cancer to optimize the use of PARP inhibitors and personalized treatment options. We need to engage a more diverse population of patients and to address regional and systemic gaps in care. And we need to remove barriers to timely genetic testing of unaffected relatives of ovarian cancer patients. And finally, we need to incorporate the patient voice in as many steps as possible. I don't dwell on the what ifs, Jessica, and I consider myself fortunate. I live in a major metropolitan city with access to the most highly qualified medical practitioners. I have a dedicated family doctor, and I have access to psychosocial support in addition to a network of family and friends. Of course, I'm greedy. I want more time, and I want the same for all women facing this diagnosis.
Thank you, Martha. As someone who studied a rare ovarian cancer, it's incredible to see how far we've come and the national attention and collaboration to improve the options and outcomes for these patients that's happening now. But you're right, more needs to be done, and Ovarian Cancer Canada is committed to keep this momentum going. Livia, so you participated in Ovarian Cancer Canada's focus groups to guide strategic directions, and you were instrumental in developing our patient partners in research program guidelines, so thank you. Can you tell us a little bit more about these experiences?
Sure. These were amazing experiences, Jessica. The focus group, you know what, it really provided us with an opportunity to meet administrators that were affiliated with Ovarian Cancer Canada's program and strategic initiatives. So our lived experiences and all of those emotional journeys, they're not just ours. They're literally carried by Ovarian Cancer Canada, and they're integrated into every single step, every single decision, every single dollar that is spent. The focus group really, really listened to us, and they let us know that without us, there is no organization. So our feedback was heard by the board of directors, and it really drives those strategic plans that we're fighting for today. And you mentioned our patient partners and research program guideline. I have that ready right here. So I just wanted to hold that up. We are so proud of this. And this is our lovely co-lead Shannon, who's on the cover very proudly. So I just wanted to talk a little bit about this. So our responsibility was really to review a lot of the program guidelines, some of the the partner agreements that we had in there, and there was like an information sheet. So the guide represents, as we've mentioned, it's our journey as a patient partner, and it keeps the voices of those with lived experience at the forefront of research. It covers the expectations of the program. It goes through like boarding processes, training, the framework to patient engagement and research, partnerships, and even talks about like clinical trial research teams. I had the privilege of and really honor of working with one of our team members, Linda Brown. She's another Teal sister and a patient partner. So it was just the two of us, and Linda had like spot on the right idea. It was a perfect opportunity for us to kind of get to know one another and really enjoy and embrace this process together. So we took on the challenge of working in different time zones around doctor's appointments, and some days really depended on how we were feeling that day. So besides the hard work that we had on editing, formatting, and we had our comments and computer issues, we had endless laughs throughout the entire process. And she was the one that actually inspired me to even chop my own hair one evening after we got off on a video chat. We had a really, really great time, and I look forward to all the other opportunities that we have together.
That's so great to hear. And I'm so grateful for you and Linda for all your help. I'm so proud of our patient partner and research guide that we created together. And also, Livia, your hair looks amazing short, so it was a good choice. Julie, so you have been involved as a patient partner on a national research project that's exploring the impacts of hereditary cancer syndromes with regards to a patient care's experience, finances, emotions, and lifestyle. Can you tell us a little bit more about this project and what role have you played in the direction of the research?
Sure, I'd be happy to. So in April 2021, I was contacted by Dr. Yvonne Bombard to write a letter of support for a team grant on the indirect socioeconomic burden of inherited diseases. It was titled Variations in Care for Hereditary Cancer Syndrome Families, both direct and indirect socioeconomic impacts. And so I was invited to collaborate on the grant application, but further than to also be a patient advisor on the project as it went forward. So I agreed quite happily, and so along with 5 other patients, I'm now co-author on all of the associated publications with this research study, as well as poster presentations at conferences. And to date, there have been 9 around the world, 8 in North America, 1 in South Africa, and 1 peer-reviewed abstract published so far. So this is a team study that recognizes that hereditary cancer syndromes are one of the most common forms of inherited disease, with hereditary breast and ovarian cancer syndrome, as well as Lynch syndrome being the most prevalent. And these patients are more genetically susceptible to developing cancer in their own lifetime, and often they require consistent lifelong screening and monitoring, as well as in cases like mine, treatments now and again. So the study examines how various facets of the patient's lives may be affected by the diagnosis, which will include, quite broadly, the psychosocial, the financial, and lifestyle decisions that these patients and their families would make over a lifetime as a result of having to always think about cancer risks. So personally, I contributed a letter of support to the Canadian Institute for Health Research, and I've provided commentary and suggestions on everything from the research instruments, such as the interview script, on the analysis of the results, and on drafts of various publications and poster presentations. I bring to bear not only my experience as a patient, but also my professional experience has come in handy as well. And to date, within this particular study, 72 patients across BC, Ontario, Newfoundland have been interviewed, and those 9 conference presentations have been made. So next steps involve final data analysis, and I will get to be part of that process as well.
Wow, Julie, that sounds like such an incredible project, and that you've been involved since the inception of the project. That's really awesome. It's patient engagement at its finest. So I'm really looking forward to reading more publications that come from this work. So it's really exciting. Martha, so you had the unique opportunity to participate as a patient partner on a grant review panel that evaluated applications focused on testing novel treatments in preclinical studies. For this grant competition, there was a specific call for treatments that could benefit women with rare types of ovarian cancer. Can you tell us a little bit more about your experience as a full voting member on this grant panel, and what was it like to be at the decision table?
Thank you, Jessica. Admittedly, I was apprehensive. Grade 12 biology is the extent of my medical background, and these were some of Canada's leading researchers. I was intimidated, although I had no reason to be. My late great colleague, Colleen from Saskatchewan, and I were given 5 applications to evaluate. Each application was approximately 100 pages, dense technical reading. Prior to our meeting in October 2020, we were invited to a briefing session that was particularly helpful and included tips on how to navigate the abstracts, where to concentrate our reading, and how to evaluate and grade each abstract. Over $2 million was to be awarded among the top projects. Colleen presented first at 6 a.m. Saskatchewan time. She was self-confident and exceedingly well prepared with her take no prisoners approach. Her attitude contributed to my self-confidence. As patient partners, we were provided with the same evaluation forms as the scientific reviewers. And what were we looking for? High commercial and scientific merit. Was the proposal worthwhile or different from other projects from a survivor perspective? What were the benefits? Will this novel treatment have a broad impact across all types of ovarian cancer, or is the proposal targeting a subpopulation? Are there potential side effects? And if so, what's the quality of life affected? Is there a probability of a cure or a prolonged length of disease-free remission? Is it national in scope? Is this a first-line therapy? Each presentation consisted of 2 scientific reviewers and a patient partner, where we evaluated, reviewed, and assessed, followed by a group discussion, after which a ranking score was assigned to each presentation. We were given the opportunity to present our scores and to defend and state why we scored the way we did. I think for me, my greatest achievement while sitting on the review panel was humanizing the research from the patient perspective. In other words, sharing my story and my lived experiences with the scientific team and drawing on my personal experiences to provide insight for these research projects.
Thank you, Martha. And Colleen seems like she was such an incredible person, and I know she's greatly missed by our entire team. As you mentioned as well, I think it's extremely important to have patient partners share their lived experience with these researchers when developing the grant proposals at that stage, to really humanize the research from the patient perspective. And I do believe it really does enhance the quality of research as well. So Livia, you had the unique opportunity to be interviewed by a biopharmaceutical company to discuss what it is like living with ovarian cancer. And this included how the disease impacts your everyday life and your personal message of what you want people to know about the disease. And this video was shared with their staff. Can you tell us a little bit about your experience with collaborating with this company, and what was your personal message that you shared with them?
Sure, Jessica. So again, another fantastic experience. Just a little bit about how the opportunity even occurred. It came about because this biopharmaceutical company, they were interested in spotlighting a patient experience with staff, and they reached out to Ovarian Cancer Canada. And it's actually the patient partner and research program. They help to facilitate these requests. So that's where I was honored to share my experience and my perspective with that company. So what transpired, an engagement manager, she contacted me, and we had a wonderful relationship. And I would say it was about that 2-month time frame. The company, they were very flexible with the location shoot of the video. I actually had a doctor's visit in Toronto at the time, and they scheduled their filming at the hotel that I was staying at. So everything was just great. The crew came out to do the video. Again, they were extremely kind, very knowledgeable, and so patient with everything. We just pretty much began talking about my experience, starting from what happened in my life prior to my diagnosis, and then going into the day that I was urgently having surgery. We talked about my treatment, how I felt. I was pretty much thrown into a bucket of the standard, here's your 6 rounds of chemo. And I shared some of my photos that I took of myself throughout my journey with them so they could put that into their video. And kind of spoke about the side effects. As I mentioned, they were just, for myself, they were just very agonizing. And having an oncology team that wasn't there to support me initially, that was very difficult. Then we talked about how it took me finding Ovarian Cancer Canada, and OV Dialogue really saved me from being so shut away from everyone else. Like, women were connecting with other women, and they were getting answers on ovarian cancer. I wasn't. It was everything that I was really looking for. So you talked about my message to the biopharmaceutical company. So, even the researchers that are there, even the scientists that were there, you have to do what you can. You need to continue that research to save our lives. Truly, you're all the hope that we have. And if it isn't for a lot of those treatments, we have nothing. I was just so humbled when that manager shared with me that my testimony touched everyone within the company. And my message about women living with ovarian cancer, it was truly heard. They also requested to have another media opportunity with me later in this year. So I look forward to spreading more about our mission and really making that research a priority. And when we talk about this relationship, it really shows us how that the biopharmaceutical company, they recognize the value of the true patient partner experience and providing that realism to their staff. Like, we are far more than a research project. We're far more than getting another degree or getting a new drug. Like, we are living with ovarian cancer. We're human beings and we want to live, and we deserve the right to live another day. It was wonderful.
Wow, it really sounds like a wonderful experience and such a powerful message you shared with the company. And I'm just happy to hear that this collaboration is continuing too. That's awesome. So Julie, we'll continue with you. So you recently spoke at the Let's Talk Cancer event, which is a symposium for high school students that gives them the opportunity to learn about cancer from scientists in the field and patients living with the disease. Two of the graduate trainees that we're hearing from later tonight actually helped plan this event. So can you tell us a little bit more about what it was like sharing your story with this young generation, and what message did you leave with them?
Well, I began by asking these 160 11th and 12th graders who amongst them had family members who had been affected by a cancer diagnosis, and nearly everyone put up their hand. Maybe 4 or 5 didn't. And then I narrated about how when I was their age, my family doctor advised my parents that I should receive a prophylactic mastectomy because my mother had developed breast cancer at the age of 24, and I was the daughter who looked most like her, so he thought that I would be the one most likely to develop breast cancer. So my parents deferred on that decision, thankfully. But that kind of got their attention. And from there, I told them the story of receiving a diagnosis at age 35, that it was thought to be, late stage. It was stage 4. I found it in my neck. I wasn't expected to survive, but I did. And I framed my 20-minute talk in terms of why I believed I was still alive 12 years after that initial diagnosis. And I'd had a brain metastasis, and I'd had 2 subsequent lymphatic metastases. But I identified 3 main families of causes. And the first I thought was that at the time of diagnosis in Ottawa, there was a nimble and responsive healthcare system, including specialists in gynae-oncology. Secondly, I thought I was still here because of a wide spectrum of personal resources, which included my own inner capacity and resolve to become an informed patient engaged in my treatment and outcomes. As well, though, I had supports of my family, my husband, and many others. And then third was that I just happened to be riding on this wave of excellent timing, that all along the stages of my journey, I was there where there was this emerging research and knowledge at each stage, where novel maintenance therapies like the PARP inhibitor was available, a novel form of localized radiation was available. Anyway, it gave a frame. And so more than being a sensational story for these students, my goal for the talk was to leave them with a belief that pursuing a career in health sciences, and specifically in gynae-oncology, could lead to a meaningful and impactful personal career for them. And I really left with the feeling that it gave them that message.
That's amazing, Julie. I'm just so happy that you got to have that experience. And so we are running out of time. I just want to make that one note. So Martha and Livia, I'm going to combine your question. It's actually on the same thing. So Ovarian Cancer Canada is committed to supporting the young generation of scientists, the next generation. So you guys both, reviewed the Anita Unruh Prize, and this was established by Patrick McGrath in honor of his wife, who is actually a former associate dean and professor. And this prize is awarded to an outstanding trainee. So you both reviewed the applications and helped select the award recipient. So can you both tell us a little bit about your experience? Hopefully a little bit shorter. So I'll start with Martha.
Sure, I'm happy to. And I won't go into the kind of quick explanation as to how we determine scores. I will say that each of us were paired with another patient partner, and together we had to arrive at a joint pair score. And the winner was determined by the highest average score. So I'll just say it in one very short paragraph. Keen to alter the trajectory of the disease, mindful of the path ahead, aware of the statistics and sensitive to the challenges. My overall feeling, Jessica, was how impressive these PhD candidates were. The scope of all four were closely connected to ovarian cancer and relevant to the ovarian cancer research pillars, and yet each represented a unique range of scientific hypotheses. Overall, I would say, Jessica, the future of research is well in hand.
Awesome. And Livia, we'll finish with you.
Yeah, I really echo what Martha stated there. From being able to collaborate on these remarkable research papers that we were taking a look at, it was truly awe-inspiring. And even from my perspective from the medical field, I was able to recognize a lot of the content that was there, but being on the other side and being able to do this in a non-judgmental location. It was safe being amongst our colleagues. When it came time for us to all be together, we had to be able to defend a lot of our perspectives, and it also took us listening to each other. So we had to be really open-minded, and it was just thinking that in the end, like, we all come from different backgrounds and experiences, and to be able to unite on research related to this disease was truly inspiring, remarkable.
That's great. It sounds like an awesome experience. So we're going to wrap up this session. So I'd like to thank each of our panelists today for speaking to us and giving us just a glimpse of the type of research opportunities that you can be engaged in as a patient partner in research. And so we're currently looking to expand our team. If you're interested in learning more about the Patient Partners in Research program, my contact information is now there on the slide there. So please reach out. I'd love to hear from you. And thank you. And I'll hand that back over to Steph then.